Okay, so this client is a 79-year-old female who recently had a fall and she had a right total hip replacement. So with that, I anticipate some weakness in the hip and maybe some pain, difficulty getting around. And she also had a left CVA, so I would anticipate with that just weakness on the right side. So, I'm gonna go wash my hands first. Hi, are you Susie?
Yes.
Hi, Susie. I'm Kendall. I'm gonna be your occupational therapist today.
Okay.
So can you just confirm for me, when is your birthday?
December 18th, 1945.
Okay, awesome. And then do you know where you're at right now?
Yep, I'm in my room.
Okay, are you at home or where are you?
At the hospital.
Hospital? Okay,
Yep.
perfect. And do you know why you're in the hospital?
I fell.
Can you tell me more about your fall? How did that happen?
Yeah, I was in the kitchen putting away the dishes from the dishwasher, and I just remember seeing these dots, and next thing I know, I'm on my floor.
Oh, I bet that was scary.
I thought it was fine.
It was okay?
Yeah.
And then how much pain is the hip causing you today?
It's about a 6.
6? Okay. So yeah, has they given you any ways to like manage your pain or anything like that?
I think they give me some medicine.
Okay, that's good. Yeah, so if you feel like the pain gets worse, you can always talk to your nurse or doctor about that and see if they have any other ways you can use to manage it.
Okay.
And I will go ahead and start by checking your vitals. Alright, can you see this one over here? Okay, checking your blood pressure. Okay. Your blood pressure is a little low. I had you at like 106/69. Do you know if that's normal for you? Is it typically lower?
I don't know.
That's okay. Yeah, that could have also been why you fell, so we'll keep monitoring that throughout the session just to make sure you're okay. And then with your hip, did they go over any of the precautions they want you to follow? Things we do to avoid injuring that surgery site more?
I don't think.
Okay, no, I can go over those with you. So, since you had like a posterior approach, meaning they went into your hip from the back side, we don't want you to bend forward at your waist past 90 degrees. So you can bend forward a little bit, but not too far. And we don't want you to cross your legs, and then we don't want you to rotate that leg either like this. So you can get up and walk, and we'll try and stand you up at the end of the session if you feel up to it, but we just don't want you to turn your feet at all. Just try and step forward as much as you can. So, are you able to repeat those back to me?
I think you said no crossing my legs. No turning my foot.
There was one more. Something about bending?
Oh yeah, I'm not allowed to touch my toes.
Right. I'm glad you didn't do it right there. Yeah, that was perfect. And then, real quick, before we get you standing, I can go ahead and just look at, I know you've had some lymphedema or some swelling going on in your leg, so I can go ahead and check that. It was the right leg, correct?
Yeah, I
Okay.
think pretty low down.
Yeah. Alright, checking her skin integrity. Okay, yeah, it is still a little swollen, but there's always ways we can manage that too. If you want to talk to your doctor, we can get you like some compression stockings or something, and we'll keep that under control.
Okay.
And then, since you also had a left side stroke, correct?
Yeah.
Okay.
Sometimes it'd be a little floppy over here.
Okay, yeah, that would be difficult. It's like kind of hard to do things that you used to be able to do, right?
Yeah, it's pretty good.
Good. That's what we're here for too, so we can help you. So I'm gonna run through just a little range of motion screen for you to see, kind of how you're moving, how far you can
Okay,
move both
let me
sides.
get in my chair
Yeah, as
good.
long as you're comfy.
Okay.
Okay, so let's try and go arms straight up, as high as you can go. Good. And then can you push them back behind you at all? Okay, no problem. And then can we go up to the side? Alright, and then touch the back of your head. And then can you go this way too? Good. And then let me see your wrists too. Can you like that? Down. And elbows. Elbows up. Down. And then some finger movement. Can you touch your thumb to all of your fingers? Okay. Not bad. You definitely have some movement on the right side still, so that's good. Alright. And I did want to look at one more thing before we get you standing. We're going to try a couple manual muscle tests just to see how your strength's looking on both sides. Have you
Okay.
done anything like this before?
I don't know.
Okay, no, that's fine. We'll see if you remember. So first I'm gonna test your shoulder flexion, which is what we just did, like going up to the, to the top of your head. And I'm just gonna, if you wanna get kind of right in the middle there.
Okay.
And just, can you hold it there? Is it a
Okay,
little
yeah,
heavy?
I'll hold it right here.
Okay, no problem. And then I'm gonna want you to try and push your arm up and don't let me push it down.
Okay.
Okay. Not bad. You still have some strength there. That's good. And then can we try this side too? Same thing. Don't let me push you down. Okay. Feel a little better on that side. And then we'll try abduction too. So abduction is going out to the side. So instead of going up to the front, you're going to go that way. And same thing. Don't let me push you down. Okay. And
You're strong.
Oh, thanks. You are too. And I'll try one more, just to test your elbows. So
Okay.
you want to hold your elbows like kind of bent right in front of you. And then I will try here, and then just don't let me push you down again. So try and pull it up.
Okay.
Well, that was pretty good.
Yeah,
You
like
hold
that.
on there for a while.
Yeah.
And we'll try this one.
Okay.
Ooh, that one's really good.
Yep.
Nice and strong. Okay. So do you want to try and get standing up now? See where that goes? You
Yeah, I
feeling
think
okay?
I'll get up.
Okay, not feeling dizzy or anything as of now?
I think I'm good right now.
Okay. I'm gonna go ahead and just put this gate belt on you, make sure we're extra safe.
Okay.
Alright, and then we have your walker right here in front of you, and just keep in mind those precautions I told you. So since we don't want to bend forward past 90, you can have this leg more underneath you, and then just leave that one out front when you stand up. Alright? So you have your walker here. You can go ahead and push off of the chair and then reach for the walker. So we can just stand on 3. Ready? One, oh, don't get away from me! Oh no! Okay, well that was good. Make sure you wait till I count to 3 just to be safe. But
I
now
know.
we can go ahead and sit back down the same way. So you can reach back for your chair if you can feel it.
Oh, yep. 3.
Good job. All right. Well, you did a great job today, and I will be seeing you. I think tomorrow I'll be back in.
Okay.
All right. Bye.
See you tomorrow.